Hello, we are presenting our topic on the Mayo Clinic. The presenters are as follow.
Kare Patel,
Barbara Mayadoa,
Taylor Galania, and Ashley Kellison. So my name is Ashley Kellison, and I'm starting off with the background section. And basically, it's the description of the Mayo Clinic is it is a large healthcare organization that is dedicated to excellence in patient care, research, and education. A little bit about its history is it was originally started by two brothers, William James Mayo and Charlie Horace Mayo, along with their wives. They essentially founded the Mayo Clinic in 1919. They also had the help of Augustus Stinchfield, Christopher Graham, Henry Stanley Plummer, Melvin Millay, Star Jude, and Donald Balfour. What really began the Mayo Clinic is it was a family practice with their father becoming a physician, and then it started with the two brothers taking it over as a limited partnership, expanding it into a group of physicians who shared their commitment to excellence and patient care, education, and research through teamwork. By the time they reached their mid-50s, the two brothers decided that the best way to secure the future of the Mayo Clinic was to give it away. On October 8, 1919, the brothers and their wives signed a deed of a gift donating the assets of the Mayo Clinic and the majority of their life savings to establish a not-for-profit organization. This gift would be more than $100 million today. The deed is an expression of the Mayo family values. It states the ultimate success of the clinic, past, present, and future, must be measured by its contributions to the good of mankind. Here is a picture of the two brothers and the father. The father is at the center, and Dr. Charlie is on the left, and Dr. Will is on the right. So the location of the Mayo Clinic is, the main headquarters is based in Rochester, Minnesota. However, it has over 60 locations throughout the United States. The services that the Mayo Clinic offers is a wide range. They include specialized medical care centers, emergency care centers, cancer treatments, orthopedics, and the list just goes on. The Mayo Clinic employs more than 5,500 physicians and scientists and 58,400 administrative and allied health staff members. The practice specializes in treating difficult cases through tertiary care, and it spends over $660 million a year on research and employs over 3,000 full-time research personnel. Some of the centers of excellence, there is a Boeing Centers of Excellence at the Mayo Clinic and Walmart Centers of Excellence programs. These centers allow covered individuals to receive Mayo Clinic care for certain conditions, sometimes with added benefits such as travel, lodging reimbursements for the patient and the companion. The ownership currently is that it is a nonprofit organization, and it is headed by John Noseworth, who acts as the CEO. And an interview was done with John, and the question that really stood out was, what sets Mayo Clinic apart from other organizations? His response was that it is complex, involving the history, the teamwork, and the long-standing commitment to excellence. But put simply, we fill our people. And this statement just proves how dedicated these people, these doctors and everyone is at the Mayo Clinic, wanting to help serve its patients. So I'm now heading this over to Taylor.
Oh, hey everyone. Sorry, I'll be discussing the mission and organization structure. My name is Kare. So to start off with the mission statement, it's to inspire hope and contribute to health and well-being by providing the best care to every patient through integrated clinical practice, education, and research. The vision is that Mayo Clinic will provide an unparalleled experience as the most trusted partner for healthcare. The practice values the needs of the patient as they practice a team-based approach with patient-centered care. So one of the founders, Dr. William J. Mayo, he said that the best interest of the patient is the only interest to be considered. The practice also values education and research, as nearly 600 doctoral level physicians and research scientists are employed with 3,400 other healthcare professionals working in research to understand disease processes and best clinical practice. So on the next slide, I'll be talking about organization structure. The personnel responsible to carry out this mission, vision, and goals, starting with the highest position, is the Board of Trustees, or essentially the governing body of Mayo Clinic, responsible for overseeing all charitable, clinical, and scientific practice and education, mission, and purposes of Mayo Clinic as a whole. As Ashley stated, the president and CEO is currently Dr. John Noseworthy, who, interesting enough, is set to retire at the end of the year in recent news that just came out yesterday. He is responsible for oversight on effectively carrying out the mission, vision, leading and facilitating collaborative relationships. Next, we have the Mayo Clinic Board of Governors. They essentially assist the CEO as a single internal point of governance and serves as an executive committee. They're responsible for setting up funding for research and education, along with annual budgets and creating and implementing financial models. Next down the list is Mayo Clinic Management Team. They assist the president and CEO by implementing Mayo Clinic strategic plans and disseminating of information to all sites and responsible parties. They essentially streamline any decision-making process made by management. The next two leadership positions I'll be talking about are included in multiple sites, including Arizona, Florida. They have different sites. So these are location-based leaders, the vice presidents, who ensure quality and balance in clinical practice, education, and research with effective management. They basically work collaboratively with department chairs to ensure succession plan and leadership development. The executive operation teams, they support site-specific physician leaders to implement and recommend site operating plans to align with Mayo Clinic's vision and values. The next slide, I'll be talking about the organizational units and divisions. So again, as Ashley stated, more than 60 different divisions. Basically, Mayo Clinic offers a variety of care across different specialties, including surgery, emergent, cancer, and hospice. There are more than 60 different division locations across the Midwest, mainly in Minnesota and Wisconsin. There are 2 clinics in Arizona and Florida. These include hospitals, outpatient clinics, express care centers, emergency and urgent care centers, hospice care, cancer centers, dialysis service center for end-stage renal disease, and rehab and fitness centers. So basically, with such diverse specialty-focused centers, along with appropriate leadership across the board, Mayo Clinic is able to effectively carry out their mission, vision, and values with their team-based approach and patient-centered care. So next, I'll be handing off to Taylor and she'll talk about geographic depictors.
A main geographical depictor of the Mayo Clinic is the large presence in urban metropolitan areas. There are Mayo Clinic campuses in Rochester, Minnesota, Jacksonville, Florida, and Phoenix, Arizona. These locations are not necessarily underserved, but the populations are large and diverse. When considering the healthcare market, one facility really jumps out as competition to the Mayo Clinic. This is the Cleveland Clinic. The Cleveland Clinic and Mayo Clinic have similar specialties and both have campuses located in Florida. There is competition between the Cleveland Clinic and Mayo Clinic because they both provide a network of hospitals and clinics that offer a large range of services. They both compete as academic institutions with high rankings in similar specialties. These specialties include cardiology, gastroenterology, orthopedics, neurology, and several more. Both institutions are leaders in medical innovation through cutting-edge research.
Next, we're going to introduce Barbara, who is doing the stakeholders.
Okay, yes. In regards to the payer mix, when it comes to stakeholders, it is a percentage of the revenue coming from private insurance versus government insurance versus self-paying individuals. The mix is very important because Medicare and Medicaid pay hospitals less than what it costs to treat the patients. Across the Mayo Clinic, beneficiaries of government programs, including Medicare, Medicaid, make up about 50% of the total services that Mayo Clinic provide. They're also dedicated to minority health and wellness. When it comes to insurance status, regardless of the insurance coverage, established arrangements with different, Mayo Clinic has establishments with different insurers, and which includes the ones that I've mentioned before, which is Medicare, Medicaid, the TRICARE, the Champus, HMOs, as well as disabilities and other sorts of insurance plans. In regards to patient population, the Mayo Clinic, being a nonprofit organization, is committed to clinical practice, education, research, and also providing an expert, a whole person care to everyone who needs healing. So the Mayo Clinic treats all different demographics. They're dedicated to minorities as well. They have different initiatives for health and wellness. And in addition to that, when it comes to diseases and illnesses, the Mayo Clinic treats a wide variety of diseases such as cancers, transplants, neurology, neurosurgery, cardiovascular diseases, and all sorts of surgery.
The Mayo Clinic has developed an application called the Mayo MyCare app, designed to improve care for patients and reduce the cost of care. This innovation was made for cardiac surgery patients. It is an iPad app that provides patients with detailed descriptions of treatment plans, educational materials, and modules, and a daily to-do task list. It also allows patients to interact virtually with their providers by keeping progress reports and asking questions as needed. Here's a picture of what the app would look like on an iPad. As you can see, it is very user-friendly and organized in a way to help the patients keep track of key information post-surgery. The Mayo MyCare app is currently in the rollout phase. The Mayo Clinic completed a pilot study in 2014, which I will describe some of the key findings in the next slide. This new innovation is being implemented in several facilities, but it is not yet accessible to the patients outside of the hospital. That is one goal for the future. The pilot study mentioned before consisted of 150 cardiac surgery patients. These patients had access to the app during recovery in the hospital. 90% of the participants reported being satisfied with their care as a result of the app. These patients also felt more informed on post-operative instructions after using the app. The app is expected to decrease the cost of care by reducing the length of hospital stays after cardiac surgery. It is also expected to reduce the rate of post-surgery readmission, which will help lower the cost as well.